Okay, so imagine having ADD, ADHD, and being in a neck brace for a year and being told that you cannot drive. It was very interesting, and I give my family a lot of credit and for having the patience to deal with me, because that was a long time. And then after all the therapies, I had to wear like a magnetic device for hours every day that was supposed to promote bone healing. Well, after a year, the doctor evaluated that it was a failed surgery, so I needed to have a second fusion. So I had 2 discs fused posteriorly, which was in the back of my neck and the front of my neck. So as a result, it really created a lot of atrophy in my neck muscles, and at the same time there was severe spasming, so that my neck was straight and there's not really much movement at all. So back to the story, how do you deal with chronic pain? So it took me on a very long journey, and I research extensively, and when I find that one thing doesn't work, then I go to the next thing. And what I've discovered through all these years is to layer, and there's not one quick fix for any specific challenge. And that's where our mindset really needs to change. We go to the doctor, we expect to have one pill to fix everything. We need to really open up our minds to see our bodies as a complex system. Our bodies are more than physical. Our bodies have the physical components, okay? But there's also energy that we're not taught this. Our bodies actually have specific frequencies that they hold. Organs hold a specific frequency. And when your energetic body is out of balance, of course your frequency is going to be off, and then it affects every other system. Now, where do you learn that? In nursing or medical school? Right, we don't. So it's up to us to find and complement. We got to complement the medical conventional strategies that we're taught, and we also have to bring in the other philosophies that bring in the mind, body, spirit modalities. These are ancient modalities that have worked for years. So there's a lot of truth in that. I went to the psychologist, and the best advice he gave me was there is not going to be one specific cure, treatment, modality that's going to fix your pain. But if you start journaling and you will find specific therapies, modalities, products that will work. It might give you 10%. So, for example, I learned about Young Living oils. These are the oils I use exclusively. I've researched the frequency and the healing components. They have extensive clinical data to support. And not just that, when you use them, you know whether you're getting a benefit or not. But like I said, when you use these oils, you might get 15, 25%. So a lot of people just dismiss it because their pain or whatever your challenge is not totally taken care of. So you just dismiss it as it doesn't work. And we really need to work on our concrete thinking. You need to layer what works. So for these, okay. Also, one other story. My husband went through cancer, and they recommended, and he went through chemotherapy and radiation treatment. Now, we all know that there's many side effects that result from these therapies. So this is when I went into a really deep open-minded research. I researched everything, and we brought in many different ways to heal. He had pain, right, from the tumor, and so this is when I started with Young Living oil. I even have a encyclopedia that targets specific oils and what they help mitigate, what they help heal. And these have energetic frequencies that are clinically proven, and it goes deep into the tissues. So what I do is I start with a base. You can have your standard base like coconut oil, and Young Living offers big bottles that you can start with. Since we all had really chronic pain challenges, I get the Ortho Ease. Okay, so I use this as a base, but it has many different oils, and they're all targeting different types of pain. So for example, basil. I'll add basil to this because basil has a deep penetrating effect. So whatever oils I'm bringing, if I wanted to go deep into the tendons and the muscles, I'll add in basil so that it pulls all these oils deeper and targets where I want the therapy to go. Where do you need relief? All right. So I also use Panaway. I always call it Painaway because that's what it's for. And it has, I don't have my glasses on, so I'm not sure if we're going to be able to read the ingredients here. We'll see. But it has a blend. And Young Living does have different blends specific for either respiratory or pain, many different areas. You're immune, if you have thyroid challenges, autoimmune, there's many different oils and products you can use. So then, so now I'm like an alchemist, okay, because I've been doing this for years. I intuitively just know which oils to add, how much to add. It's just what I do. So I have many of these bottles, and I'll start with a base blend depending on what the challenge is, and I will add specific oils to help target the challenge. Juniper oil is very good if you're having nerve pain or nerve issues. You need to heal the nerves. Add in juniper oil, and it is specifically to help heal with that. Here's one. It's a focus spray, and this is one that I need. I even forget what I put in there. I made it a long time ago, so that just shows you these products last for quite a long time. And this one's just, I mean, it has dog hair and everything else. This is my dog, my pet blend, and it's for Tom and me too. At nighttime, when any of us are in pain, I'll pull out this bottle and I create my own blends. I just I make a whole bottle, and then we use it. Bachi is having a lot of she has arthritis in her foot, and sometimes she can hardly even put weight down on her foot. It's very sensitive. So I blend in many different things, and like the therapist said a long time ago, I'll add pain medication, which lasts for 4 hours. So we'll start with that just to take the intensity out of the pain so she can put weight back on her foot. And then, but that wears off, and that's probably 60% effective. But then I'll add in the blend. Like a few minutes ago, I added on, and she's still getting used to it because she was a rescue, and she has to get used to Mom's therapies. Anyone who knows me knows I'm known for my therapies. So she would run away, and then of course I have to, be very compassionate and gentle and ease all her anxiety, and to introduce these things that will help her ease her pain and her anxiety. So now we've come to an understanding. Like, she'll run away, but then she'll put her head down and say, oh, okay, Mom, I know this is going to help me. And so I used Ortho Ease, and then I added a few drops of Panaway. And she lets me put it on. And afterwards, you can see that she just settles in. She's able to relax, and it takes the intensity out of the pain. So learning what products give you relief. Start journaling, start playing, and open yourself to try new things. We're creatures of habit. We get in our habits and we tell ourselves, oh, this isn't going to work, that's not going to work, or this only worked for an hour, so it doesn't work. You need to open up your mind. And this is where I'm constantly working on myself. So I have journals and journals of products that I've used, and if I feel any relief at all, 10-15%, that's on my go-to list. I will add that in, and then I'll add something else. So if I have 15% from perhaps diffusing oils and just smelling them, right? Because that increases your frequencies in your brain and calms your neurotransmitters, calming the brain waves, so it reduces any anxiety that you get as a side effect from dealing with pain. So that's 15%. Then I get maybe 25% from actually putting the oils on my body wherever I'm having the pain, or whoever I'm helping mitigate these challenges. So that's what, 25, 35, 40% there. So if you have to use some type of pain, conventional pain adjunctive pill, that's what, 60. So you're at 100% there, but you know that it's always going to have side effects. So learn how to layer, and if you get even a little relief, add that in and make a list of what works for you. All right, so that's pain. I'm going to share a couple other strategies that I use. Again, I use Young Living oil. They are costly, some of them, and some of them are, very affordable. But what I do is